Uh, I thank Bimacon organizing persons for inviting me and giving me the opportunity to tell about the recent current few topics. Very important topics is cervical cancer. 95% of the cases is HPV virus is the cause of this cervical cancer. Now, this is the basic burden of cervical cancer in India. 1 million women at risk, and the deaths around 77,000 per year. So, women who are older than 15 years at risk of developing cervical cancer. And start with what are the risk factors for cervical cancer. Most common are the smoking. It has been seen those women who smoke actually have just 2 times chance of developing cervical cancer than the non-smoker. Age as the first priority, sexual intercourse less than 18 years. Now, India accounts the highest cervical cancer related mortality rates globally is around 60%. So, one Indian woman dies due to cervical cancer every 8 minutes. So, it is a huge burden. And then we have to consider for fertility sparing surgery. So this is the pathologic assessment where we have to basics the not only the uterus, cervix, we also assess the lymph node by some genetic mutation, some marker mutation that I'm coming again. Now there are some non-fertility sparing and fertility sparing surgery. Now what are the diagnostic tests? Suppose patients come with a cervical cancer, we can do some non-visible lesion. We can go for the cone biopsy or cervical curettage. And it has been seen that PD-L1 expression in the cervical cancer has reported from 34 to 96%. So high prevalence of PD-L1 expression. This is the gross staging of cervical cancer. You know, we can divide the cancer as localized, locally advanced, and advanced. Fully by HPV vaccine by the age of 15, 70% screening, they are doing much more happening on the screening purpose, as we can detect the precancerous lesion before development of the full-blown cervix. So 70% of the women should be screened with high performance test by the age of 35, again at the age of 45, and 90% of the treatment. So precancerous women patients also get treatment, and also 90% of the patients who get the invasive cervical cancer. Personal experience, we have seen there is a very soothing effect, there is a less side effects compared to the chemotherapy in the immunotherapy and targeted therapy part. There are nominal side effects that all presents, be it the chemotherapy or immunotherapy, like myelosuppression or asthenia, fatigue, and there are some new emerging immunotherapeutic